Hi, this is Victoria Smart, and today I'm going to be collecting a sputum specimen. First, I'm going to verify the healthcare provider's orders. I'm going to provide patient privacy and perform my hand hygiene. I'm going to introduce myself to the patient and their family if present. I'm going to ask the patient their full name and date of birth and identify them using two identifiers up against their wristband. I'm going to explain the procedure, whether it be through expiration or suction, what we will be doing today, and make sure that they understand and I gain consent. I'm going to then assess the patient's respiratory sounds and status and ask about their anxiety level. Next, I'm going to be doing a specimen through having the patient cough. I'm going to give the patient an opportunity to wet their whistle and rinse their mouth with water. I'm going to apply my clean gloves and then provide a sputum cup with measurements on the side that we will be wanting to collect between 5 and 10 milliliters of sputum. I'm going to instruct the patient not to touch the inside of the collection cup or the inside of the cap. I'm going to ask the patient to take slow, deep breaths, and after a couple of those, they're going to want to hold it and then exhale and cough sputum directly into the container cup. After about 5 or 10 times doing that, or until we have about 5 to 10 milliliters of sputum, I'm going to take the cup and wipe down the edges of it with a disinfecting wipe. Then I'm going to offer the patient a tissue and dispose of any of the used tissues or used supplies in the appropriate receptacles. And then if I am going to be collecting the specimen through suction, I'm going to position the patient in a semi to high Fowler's position. Then I'm going to apply my clean gloves to my non-dominant hand, and then I'm going to prepare the suction machine or device I'll be using. I'm going to connect the suction tube to the adapter and the sputum trap. I'm going to open the container of my sterile water and put some into the sterile holding container. Then I'm going to apply a sterile glove to my dominant hand, and with my non-dominant hand, I'm going to lubricate the tip of the suction tube, and with the suctioning still off, I'm going to warn the patient that the suction will probably aggravate the coughing reflex, which is good. That's what we want. And then I'm going to gently insert the tip of the suction catheter through the patient's nasopharynx or tracheostomy tube. I'm going to gently and quickly move it past their nasopharynx and into their trachea, collecting about 5 to 10 milliliters of sputum. As the patient coughs, I'm going to be collecting the sputum for about 10 to 15 seconds and just telling and reassuring the patient to breathe normally during the treatment. I'm going to stop and release the suction of the catheter and remove the tubing itself, making sure that the suction is turned off. Then I'm going to detach the catheter from the specimen trap, dispose of the catheter, and then tightly secure the lid of the sputum container. When any sputum is anywhere where it shouldn't be other than inside the container, I'm going to make sure that I wipe everything down with a disinfecting wipe. I'm going to offer my patient's tissues once again and dispose of any of my used or dirty supplies. I'm going to place the specimen into a biohazard bag and making sure that I'm attaching the proper paperwork and forms with the bag. I'm going to immediately send the specimen away to the lab to get tested. If not, it should be refrigerated for later transport. I'm going to offer the patient mouth care if they would like, and then I'm going to help them into a comfortable position and make sure that their toiletries and their personal items are within reach. I'm going to make sure their call light is within reach and that they know how to use it. Um, Make sure that the bed rails are raised upright for patient safety and that the wheels on the bed are locked and the bed is in its lowest possible position. I'm going to dispose of any dirty or um, soiled supplies that I might have used and leave the patient's room tidy. Then I'm going to dispose and remove my gloves, perform my hand hygiene. As a part of the follow up care later, I'm going to review the results of the sputum from the lab once the results are back, and then I'm going to document and report the patient's response to the suctioning and any expected or unexpected outcomes.